commitment in the elective reform plan that we outlined last year, that patients are kept up to date about where they're being treated, why they are being referred on to perhaps a more local service, and we will continue to try and do that.
Thank you, Mr. Speaker. And last month, the Health Service Journal reported that elective waiting list target was met largely because a record number of patients were removed from waiting lists in March without receiving treatment. So can the Minister tell the House how many patients were removed in March, what happened to them, and whether she is satisfied they definitely didn't need treatment? Yeah.
Well, again, as I said earlier, I'm still a bit perplexed as to why the Conservatives are perpetually highlighting their inadequate management of the health service and the idea that patients are simply referred to a waiting list and then left there for a couple of years, which is what happened under their watch. It is important that patients know why they're on a waiting list and that obviously they get the best clinical care as quickly as possible. I don't have to my hand the exact figure in March. That will obviously be published as part of the normal process when we publish the waiting list targets. I can tell him that completed pathways were 5.9% higher in the 21 months from July 24, when we took office, to March 2025 than the previous 21 months. Patients are getting the right care in the right place that they deserve under this government.
Good job.
Question number 12, please, Mr. Speaker.
Mr. Speaker, it's not just the Conservatives raising this, it's patients and the Health Service Journal. And the answer is 350,000 people. That's a city the size of Coventry, wiped off the waiting list with no treatment. And it's 100,000 more than the month before. So if there's genuinely nothing to hide, the government shouldn't worry about pushing these figures out. So will the Minister commit to a review to find out what's happened to these 350,000 patients? Or does she believe that waiting lists should be met by removing patients from the figures rather than actually treating them?
This is an established way of managing waiting lists and waiting times. We are making sure that there is adequate clerical and clinical validation of the list and that patients are treated where they need to be, closer to home and often in more local circumstances. Of course, we have committed to greater transparency than was had under the previous government. We continue to do that. Obviously, if there is something that comes through that, I'm very happy to the exact question I didn't quite follow from the honourable gentleman. We are confident in the data that is coming forward. As I said, this is standard practice. It is roughly about 15%, as it has been over many, many years.
Thank you, Mr. Speaker. Number 12, please.
Minister.
Thank you, Mr. Speaker. Health visitors play a vital role in supporting babies, children and families. Under the previous government, the number of health visitors fell significantly, which is why this government has taken action. The upcoming professional strategy for nursing and midwifery will set out a bold direction of travel to strengthen health visiting across England, and we have already made improvements with all post-birth health and development reviews now completed for over 80% of children nationally, the highest levels since recording began.
Thank you, Mr. Speaker. I recently gave evidence to Baroness Amos's National Maternity Inquiry showing the trauma my wife and I endured. And after the birth, even as she carried her own burden, she was my rock. But the NHS was not. I was invisible, no one asked about me, and I was left to carry it alone for months. So will the Minister please ensure that health visitors recognise dads and other non-birthing partners, check in on their mental health and help them access support so that no more dads are forgotten when families need them the most?
Thank you, Mr. Speaker. And can I thank my honourable friend for being so brave and willing to share his and his wife's birth trauma and about the lack of support afterwards, not just with Baroness Amos and her review, but with the House today. I know personally how hard it is to do that, but I also know the huge difference it can make to government policy. I am happy to commit to him today that the government will absolutely look closely at all of the findings in Baroness Amos's review and with the National Maternity Task Force to translate the recommendations into action. I am also pleased to confirm that we have recently updated our National Health Visiting Guidance to include a high impact area on family mental health, with a clear focus on supporting both mothers and fathers.
Bumbo.
Speaker, it's not just the number of health visitors that needs improving. Women report to me they've skipped appointments due to negative experiences with health visitors, especially around breastfeeding. Will she commit to improving the training of health visitors so that women are receiving the best quality care?
Yes, I will. We are busy working on the 10-year workforce plan, and the training of all the NHS workforce, including health visitors, is a big part of that. I am in my new position as Public Health and Prevention Minister. I am particularly interested in the work of health visitors, and especially with regard to breastfeeding and supporting rates of breastfeeding. And he will be aware that the breastfeeding survey was released, the results of that was released last week, and they did show substantial improvement.
Question 13, please, Mr. Speaker.
Minister.
Thank you. This government is rebuilding England's broken NHS dentistry system. The Dental Recruitment Incentive Scheme encourages dentists to work in underserved areas. Data on the scheme's effectiveness will be published later this year. We're taking steps to increase the supply of dentists. For example, last week I was very proud to announce the first sustained expansion of dental school places since 2007. Backed by £11 million per year, a total of 50 dental school places a year have been allocated.
Mr. Smart.
Thank you, Mr. Speaker. My constituent John, who's from Bredbury, has been in touch because, like with so many others, his local dentist is going private. And for many families in my constituency, private dentistry simply isn't an affordable option. Research by the British Dental Association found that 96% of practices are not accepting new NHS patients, and a golden hello worth £20,000 over 3 years isn't adequately compensating for a contract that loses money every day. The scheme just isn't working. It's recruited 2 dentists, 2 in the whole of Greater Manchester, neither of which is in my constituency. What more can the Minister do to make sure my constituents get the dentists they need where they need them?
I thank her for that question, and she's absolutely right to raise the issue of the contract. The fundamental problem is that the units of dental activity system is a contractual system that does not work for NHS dentistry. That is why we had the absurd situation when we came into office in July 2024 that there was a £392 million underspend on NHS dentistry because dentists weren't incentivised. We're changing that. I've got the underspend down to 36 million. There's still a very long way to go, and we need to reform the long-term contract to incentivise dentists to do NHS dentistry.
Whereas, Mr. Speaker, access to NHS dentistry remains too difficult in rural and coastal communities like South East Cornwall, where residents face long travel times and limited provision. So would the Minister meet with me to discuss what next steps we can take to improve local access?
I thank her for that question, and she's absolutely right that there are areas of the country, as we know, that are known as dental deserts. We have to fix that. It comes back again to the fundamental issue about how to incentivise dentists to do NHS dentistry, regardless of where they are in the country. But there are particularly acute pressures in constituencies such as the one that she so brilliantly represents, and I'd be happy to meet her to discuss it further.
Elsa Blunden.
Question 14.
Minister.
Thank you, Mr. Speaker. We know men are less likely to seek mental health support and suicide rates are higher in men, and we are taking action to address this. Through our men's health strategy, we've launched a partnership with the Premier League to improve mental health literacy. The Suicide Prevention Support Pathfinders programme will invest up to £3.6 million in areas where middle-aged men face the greatest risk of suicide, the North West being one area with some of the highest rates.
Elsa Blundell.
Mr. Speaker, and I welcome the publication of the Men's Health Strategy, especially the measures in it designed to improve mental health outcomes. In a report that I recently sent to the ministerial team following an event that I held with local charities and mental health service users, it became really clear that the recommendations of that strategy need to be implemented quickly. What practical steps are therefore being taken to implement those measures, especially in areas like mine, where deprivation continues to really affect the health of men and boys?
I warmly welcome my honourable members, my honourable friend's report, and can I thank her for all her work on behalf of her constituents. Locally, NHS and council partners are supporting delivery through services like Thrive, Thinking Ahead, Talking Therapies, alongside community initiatives such as Male Health Survivors at the Dale and Andy's Man Club, Rochdale, supporting men's mental health. We also have a mental health call for evidence, which is now live until the 12th of July, seeking practical examples to tangibly improve outcomes and inform our mental health strategy. And I would be very keen to work with her on what more we can do.
Tim Farron.
Mr Speaker, the suicide rate amongst men in Cumbria is twice the national average. There are a whole range of reasons why that is so. One of them is clearly bound up in isolation and rurality. I wonder whether the Minister will be willing to meet with myself and the Farmer Network as we seek to deliver mental health answers to people struggling. Often, when you've got 25% of farmers on less than the poverty rate, when you've got people who are isolated, dealing with transition at times of enormous stress and anxiety with nowhere to turn, would she agree to meet with me in the Farmer Network so we can address this particular cause of this appalling tragedy in our county?
Can I thank my honourable friend for raising that really important issue? And of course, we must not overlook the needs, especially with farmers, as he raised. And our men's health strategy has invested an extra £3.6 million in suicide prevention work in the most deprived parts of England, where men face the greatest risk of suicide. And the partnering work that we're doing with the Premier Leagues Together Against Suicide initiatives to meet men where they are on their term, so they don't suffer in silence. And I'd be really, I look forward to working with him and meeting with him to hear more about this.
Lewis Cocky.
Mr Speaker, question 15.
Thank you. Mr Speaker, the NHS Modernisation Bill will clarify and strengthen accountability in the NHS. It ends fragmented accountability that we inherited on coming into government, and the reforms will restore clear democratic accountability with the Secretary of State directly accountable to Parliament and the public, and we will enhance local autonomy, ensuring NHS organisations are good partners and deliver for their local populations.
Lewis Cocky.
Thank you, Mr Speaker. We need more local accountability in the NHS. In Broxbourne, we've seen thousands of new houses built, but when I and local Conservative councillors have pushed for new healthcare facilities to cope with the new demand, we have been refused. Can the Minister explain, under their new system, who will be accountable for that?
He highlights a situation familiar to many of us, one of the many problems that we inherited from the last government with this fragmented landscape. So I thank him for his question. And the ICB, clearly responsible for commissioning for their population to improve access to healthcare and reduce inequalities. That's absolutely a key part of their responsibility. And they will be held accountable through the outcomes framework. It's the first time ICBs will be held accountable through that process.
Alan Dolan.
Mr Speaker, Jules Fielder from Hastings was diagnosed with stage 4 terminal lung cancer after doctors missed her symptoms, mistaking them for tennis elbow. As a non-smoking young woman, she was not meeting the stereotype of what lung cancer patients often present with, but she was determined to channel her own tragedy into change. She campaigned for better, earlier awareness among clinicians and members of the public of symptoms, and she took this message to everyone she could. Together, we convinced Boots to roll out on-shelf awareness labels in the cold and flu medicine section to raise better awareness. And sadly, Jules passed away last month. Will the Minister join me in paying tribute to all of Jules's campaigning and commit to continuing her vision in the Department of Health of making sure we use every possible avenue to raise better awareness and catch cancer earlier?
Well, I thank her for raising that example of tremendous public service in the face of the adversity, and obviously we are sorry to hear of Jules passing, and our thoughts are with her friends and family. But she does highlight the way in which people can access and determine outcomes, and it is the responsibility of those working in local health services, particularly in this case the ICB, to have that way of involving people and actually using their experience to drive change that we want to see as part of this health bill.
Auburn.
Question number 1.
Sarah State.
Mr. Speaker, the NHS matters deeply to me, to every one of my colleagues and to people right across the country, and that is why we are not wasting a second in driving delivery and pushing forward with extending prostate cancer screening to protect men at most risk, appointing a new national maternity advisor to give every woman and baby a safe birth, accepting the Mann Review recommendations to rid the NHS of anti-Semitism and all forms of racism, and of course, with my honourable friend, the member for Bristol South, taking the NHS Modernisation Bill through its second reading last week. As Secretary of State, I am determined to accelerate modernisation and build an NHS that is fit for the future.
Thank you, Mr. Speaker. Following power outages at Eastbourne District General Hospital that left operations and births suspended, hospital bosses submitted a strategic bid of over £10 million to the Estate Safety Fund to urgently fix this, which was rejected. So how does the Secretary of State expect our hospital to provide consistent and safe care to patients without the power going out?
Mr. Speaker, I'm aware of the issues at Eastbourne District General Hospital, and patients, staff and visitors deserve better than power cuts and electrical failures. But that is why this government has set out a credible and deliverable plan to deliver the new hospitals programme. And I would gently remind the honourable gentleman, Mr. Speaker, and his constituents that many of the problems the NHS estate faces today stem from the NHS being starved of £37 billion of capital investment in the 2010s when the Lib Dems were in government.
Mr. Speaker, one of the biggest barriers to accessing community healthcare in Bracknell Forest is when constituents are told they aren't able to get routine diagnostic procedures done at their local GP or health centre and instead had to travel. One constituent with cancer was told he had to go to Guildford for a simple blood test. How will the introduction of a single patient record help break down some of these barriers?
I thank him for this question. And the single patient record gives clinicians that timely access to a single trusted record so that decisions can be made more efficiently, avoiding duplication, and people can spend more time with patients. And the system which makes all of a patient's information accessible in a single place will allow the sharing of patient data between different settings, as he outlines, and allow services to have more flexibility where services are made available.
Secretary of State Stuart Andrew.
Can I begin by welcoming the Secretary of State and the Honourable Lady to their places? Mr. Speaker, the Secretary of State was in the Treasury when it imposed VAT on compassionate access medicine programmes. These are programmes which, for some patients, especially children with cancer, provide a vital last chance to access treatment. The policy has already led to the closure of one scheme. Will he now commit to abolishing this tax before any more follow suit?
Well, Mr. Speaker, one thing I learnt when I was in the Treasury is that decisions about tax are taken by the Chancellor at fiscal events. So I'm certainly not, in my new role, going to start taking decisions about taxation at the dispatch box today. But the broader point here, Mr. Speaker, is how important it is to make sure we have the medicines that we need for the future. And that is why this government is investing so much in research, development and innovation to make sure we have those drugs that we need, we have the medicines we need to make sure we have the healthiest possible population in the future.
This needs decisive action now. These drugs are absolutely critical to some children. This cancer drugs tax has already closed one scheme, and companies are making real-time decisions now about whether to continue programmes in the United Kingdom. He must urgently get Treasury to permanently exempt compassionate medicines so patients in most need can get the vital drugs, because in some cases it is simply their only hope.
Mr. Speaker, I've explained the position about decisions in relation to tax, but more broadly, Mr. Speaker, it is critical that we have the medicines of the future that we need. And one of my very first visits as Secretary of State for Health, Mr. Speaker, was to visit a company who are using AI to determine new opportunities for medicines and drugs to tackle cancers and some of the other illnesses that people face. Making sure that we're investing in businesses, British businesses, to drive that innovation is crucial not just to the future health of our country, but also to economic growth.
Mary Glendon.
Mr. Speaker, at the age of 6, Eric Slake was diagnosed with metachromatic leukodystrophy. MLD is treatable if diagnosed early. His parents, Tracy and Luke, are campaigning for newborn screening for the disease. In its last review of the condition, the National Screening Committee did not recommend screening, but outlined it as gathering more evidence. Will the Minister look at ways this process can be expedited?
Can I thank my honourable friend for raising this very important matter, and my sympathy is with the Lake family and I commend them for their advocacy on this issue. I am acutely aware of this matter, having met with the member for Upper Ban and her constituents on this issue last week in a very moving meeting. I can also assure my friend that the department is working with partners to see whether it is possible to set up a multi-condition evaluation so that not only MLD but other rare conditions can be assessed alongside the existing screening programmes.
Liberal Democrat spokesperson.
Very much, Mr. Speaker. A damning report by the Royal College of Emergency Medicine has estimated that there were more than 15,800 deaths associated with long waits in emergency departments in 2025, a figure that I think we would all agree is an outrage. But the government still hasn't published reliable data on long waits and corridor care, despite promising to do so by the end of May. So will the Minister tell the House what the government is trying to hide, and will they adopt Liberal Democrat calls to end corridor care within a year by freeing up beds throughout hospitals and in social care to end the blight of excess deaths in overcrowded A&E departments?
Mr. Speaker, let me be clear that corridor care is unacceptable, undignified, and we are committed to eradicating it. Mr. Speaker, we have begun by getting specialist teams to go into the worst offending trusts to make sure we are getting rid of corridor care in those places. The NHS now has a national definition of corridor care for the first time ever. We will publish data on that shortly because I believe, Mr. Speaker, that the first step in getting a grip of the problem is to be open and transparent about its scale.
Nadia Witt.
Mr. Speaker, we all know that social care is in crisis, with huge staff shortages, unmet needs and councils' finances being pushed to the brink. So it's disappointing that the King's speech didn't contain anything on social care. With the full Casey review not expected until 2028 and implementation estimated to take up to 2036, what steps is the Minister taking now to alleviate pressures in the system? And will the government expedite social care reforms so we can meet our manifesto commitments on a national care service?
I thank my honourable friend for that question. I pay tribute to her in terms of the work that she did formerly as a care worker. This government inherited a social care system in desperate need of reform, and we are taking action, including providing over £4.6 billion of extra funding for adult social care by 28-29 and developing the first ever fair pay agreement for care workers. Baroness Casey will submit her first report this year with recommendations on the further action we should take to move towards a national care service.
Mr. Speaker, despite rising nationally, the number accessing NHS dentists in South Gloucestershire is falling, with less than a third of adults and half of children having been seen by an NHS dentist in the last 2 years. With no NHS dentists taking on patients and more going private, how will the government reverse this decline?
I thank her for that question. As I said to her honourable friend earlier, the fundamental long-term reform of the contract is vital to incentivise dentists to do NHS dentistry. But I am also very pleased by the fact that we have really put downward pressure on the underspend. And as a result of that, we're on track to deliver more than 2.5 million extra dental treatments than in the same period before the general election.
Thank you, Mr. Speaker. I recently held a health roundtable in Purbeck, and here volunteers from Parkinson's UK made clear that more needs to be done for all those living with the illness, and so they receive the robust support that they need. There was particular concern that a shift away from routine checkups could mean that many do not regularly see an experienced practitioner. Will the Minister work with me to ensure that the voices of people living with Parkinson's are listened to and their concerns are acted upon when any changes are made to the care that they receive?
People with Parkinson's disease should receive support tailored to their individual needs as symptoms progress. as symptoms and progression vary. The NHS provides specialist multidisciplinary NHS care informed by NICE guidance and improvement programmes such as Getting It Right First Time. People with Parkinson's will benefit from our wider work to strengthen community services, reducing waiting times and improve coordinated person-centred care closer to home. So I can assure the Honourable Gentleman that the Department will continue to meet regularly with Parkinson's UK to ensure their voices are heard.
Byfleet in my constituency of Woking lost its doctor's surgery in 2005, leaving residents having to struggle via the A245 to access basic health facilities that is set to get busier due to a likely housing development. Will the Minister agree to meet with me to ensure we can bring health facilities back to Byfleet again?
Yeah. Well, I thank him for that question. We have got the £102 million utilisation and modernisation fund to enable more GP primary care estate. So that's an important point. Of course, we're also committed to delivering 120 more neighbourhood health centres by the end of this Parliament. So I hope that his ICB has put in an expression of interest for our neighbourhood health centre scheme, and I'd of course be prepared to discuss that with him further.
Debbie Abrahams.
Thank you, Mr. Speaker. There's overwhelming evidence. There's overwhelming evidence that marketised health systems, such as the NHS has become, actually increase health inequalities. So will the Health Secretary consider amendments to his health bill which will tackle the rising inequalities in existing health policies, including allowing local health and NHS organisations to determine if they need additional private sector capacity?
Well, I thank my honourable friend for that, and I commend her experience in this area. We don't have plans to, particularly, she tempts me to look at amendments in that space at the moment. The changes that we make to NHS England place that responsibility firmly at the Secretary of State's doors on health inequalities in all our policies. I'm very happy to talk to her about other ideas that she has around that. The bill transforms that responsibility onto the Secretary of State, so we have no plans to make any changes in that area.
Alison Griffiths.
People in West Sussex are unable to access an NHS dentist, and many constituents in Bognor Regis and Littlehampton tell me they have been unable to secure an appointment for years. So what specific steps is the Secretary of State taking to increase NHS dental capacity in coastal communities, and when does he expect patients to see a measurable improvement?
Well, I thank her for that question. I've said to honourable members across the House today, there is the fundamental challenge around the dental contract. The units of dental activity doesn't work as a way of incentivising dentists to do NHS dentistry. So that fundamentally has to be fixed. But I am also very proud of the fact that thanks to the measures we've put in place, 2.5 million additional courses of treatment have been delivered compared to the same period before the general election.
Fairness.
Last year I had the opportunity to witness the TAVI procedure. This is a really groundbreaking procedure for people who require valve changes. I saw this, it was quite incredible, and I would recommend all of you go and see this procedure over in St Thomas's. The patient was 82, had been bedbound for weeks, but after that 20-minute surgery they were fit enough to be discharged later that same day and look after themselves. This has a massive impact, not just on the patient's life, but also for our NHS and the wider economy, as illustrated by Heart Valve's optimal pathway report. What steps is the department taking to not just on the patient, so to ensure NHS systems identify and treat?
I am aware of my honourable friend's significant work in this policy area, and she is happy. Rise in national TAVI activity and improved getting it right first time pathways are part of our approach to reduce health inequalities and supporting more timely, equitable care. And through this work, the Government is committed to strengthening consistency in the diagnosis and treatment of heart valve disease, building on progress already made.
Phil Pinkerton.
Thank you, Mr. Speaker. The relocation of Frimley Park Hospital in my constituency is a £1.8 billion project, but none of the costs of the essential infrastructure to enable this new site to go ahead have been costed or budgeted for. The chief executives of the hospital simply have said that those costs will have to come from the new hospital programme contingency fund. Does the Secretary of State agree with me that that is no way to start a project of such size, scale and significance, and would he meet with me to address those concerns?
Mr. Speaker, the honourable gentleman is persistent in raising this. He's raised this with me in the lunch queue as well. This is clearly an issue which I know matters to him and to honourable friends on my side of the House as well. But I think we need
just say to the honourable member, when he's answering the question not to meant to walk in front, please show respect to each other. Secretary of State.
But, Mr. Speaker, the honourable gentleman can rest assured that this government is focused on the new hospitals programme, which is now credible and deliverable after what we inherited from the previous government, and we will get those hospitals in place.
Christine Sullivan.
Thank you, Mr. Speaker. On Thursday, I will chair the Endometriosis APPG's first evidence session of our inquiry into endometriosis in the workplace, and we will look at the experiences of women living with the condition, the lack of timely treatment for chronic symptoms, and how this impacts them in the workplace. Will the Secretary of State commit to reviewing our recommendations once published later this year?
I commend the Honourable Lady for her great work and that of the APPG on highlighting the importance of endometriosis and the impact. We would be delighted to continue our close engagement with you and the APPG on this topic. We will consider the APPG's findings carefully when they are published as part of our ongoing work to improve diagnosis, treatment and support for women with endometriosis.
Helen Maguire.
Speaker, Epsom and St Helier hospitals need urgent funding now, not just patchwork repairs. In 2024, 600 operations were cancelled due to ventilation issues, and this situation is only going to get worse. So will the Minister address the backlog of hospital repairs now to ensure patients and staff have safe and modern facilities in Epsom and St Helier hospitals?
Yeah.
Mr. Speaker, under this government, we have increased capital investment in our NHS estates, including hospitals, because, frankly, under the previous government, that was sorely lacking and stored up problems that we are now experiencing today. There is a huge amount that we need to invest in to make sure our NHS is fit for the future, but we also need to reform the service, which is why modernising the NHS is a key priority for me and this government.
Chris Webb.
Thank you, Mr. Speaker. At the beginning of the year, Blackpool had the worst 12-hour A&E waiting times in the country, but thanks to the tireless work of local NHS staff, that's been reduced by 43%. However, we face some of the biggest challenges in the country with health inequalities, deprivation, and the 21 million visitors that come every year. So would the Secretary of State agree to meet with me and our CEO of the hospital to talk about what support we can get to bring these numbers down so that residents in Blackpool can get the care they need?
I thank my honourable friend. I'm very happy to work with him to tackle health inequalities in his area. As he rightly highlights, our investment in the NHS and in the wider health of the nation is specifically about tackling health inequalities such as those that he raises and which affect the life chances of his constituents.
Joe Robertson.
Thank you, Mr. Speaker. The crisis in social care is particularly bad in my constituency on the Isle of Wight, partly because of our unique geography, but also because the government has reduced funding to our local authority. And our council is now looking at discharging patients to the mainland away from family and friends, which is completely unacceptable. Will the government recognise our unique challenges as an English island and help provide a social care solution which recognises those challenges that we face?
I thank him, and we have discussed this issue, and I absolutely recognise the need to ensure that social care is provided in the most convenient way that is possible to his constituents and as close as possible to home. Obviously, we are fixing a broken system, but we have delivered £4.6 billion more of funding. We're delivering the Fair Pay Agreement, and we're working hard to ensure that we get adult social care back on its feet and fit for the future.
Justin Matters.
My constituents were delighted to see the opening of the Great Sutton Medical Centre, but it has brought into sharp focus the need for an urgent upgrade of GP practices in Ellesmere Port Town Centre. I've submitted an expression of interest for the Neighbourhood Centre programme. I wonder if the Minister would agree to meet with me to discuss that further.
Well, I thank him for that question. I'm delighted that he submitted the expression of interest. We're now assessing proposals against criteria, including fit with our national neighbourhood health strategy, sound estates planning, deliverability, sustainability and critically local need. And we'll be prioritising areas where there is low life expectancy, higher deprivation. So I'd be delighted to meet with him to talk about his expression of interest and about our programme for revolutionising care in our country through the shift from hospital to community.
Thank you, Mr. Speaker.
Unpaid carers play an absolutely crucial role in supporting so many people who need to draw on social care, thereby supporting our health service and our formal social care system. But they tell me they're under immense strain. They need more support. And they are, of course, more likely to be women and more likely to be older. Does the Minister recognise the urgent need for more respite care for unpaid carers? And will he take action to provide it now, not waiting a few years for the Casey Commission?
I thank her for that. She's absolutely right that unpaid carers are the lifeblood of our care system, and we pay tribute to them for the compassion that they show. I was very pleased that yesterday I accompanied the Minister from the DBT to launch the new Paid Carers Leave consultation document. I'm also very pleased to chair the cross-ministerial group that is going to produce an action plan for unpaid carers, addressing exactly the issues she mentioned about respite care.
Jen Craft.
Mr Speaker, last week the Supreme Court judgment that overturned Cheshire West, the previous judgment on the Mental Capacity Act, has thrown the sector who care for people with learning disabilities and or autism into what they have called chaos. There is significant concern that without further clarification as to whether someone can consent to deprivation of liberty who does not have mental capacity will lead to putting vulnerable people at significant risk. Will the Secretary of State listen to calls for...
Sorry, I've got to get through. I've other members again. You've got to shorten your questions to help me. Secretary.
Mr Speaker, I can reassure my honourable friend that the Government respects the Supreme Court decision. We are considering it very carefully and we will set out updated guidance shortly.
Paul Holmes.
Thank you, Mr Speaker. Waiting times for cataract operations in my Hamble Valley constituency are rising hugely because the local ICB and its AI system have stopped offering all providers it advertises and have scrapped their contract with Specsavers, meaning only GPs can diagnose the problem. Will the Minister have a look at the local problem and intervene so that we have the widest and best possible providers to reduce those waiting lists?
He's absolutely right that getting the link between high street optometrists and secondary care working more effectively is vital. That's why I was very pleased to announce the £20 million e-referral investment earlier this week. We're also working on single point of access to get that digital interface working far more effectively, and he's right that we should be focusing on that more, and there's a lot more to do.
Adam Thompson.
Thank you, Mr Speaker. I want to raise eating disorders in relation to extreme exercise using app-based fitness classes, particularly people with very low BMI doing ultra-high intensity exercise for hours every day, and how these apps can become addictive. When I wrote to one brand asking about implementing access limitation tools in their app, they were dismissive. Will the Secretary of State then consider reviewing whether such tools could be mandated to support those with eating disorders?
Well, Mr Speaker, I thank my honourable friend for raising this issue because it's an important angle on a problem I think we're all aware of, but facing a slightly different context given some of the modern features which are available on devices in our pockets. So I thank him for raising that. I'll look into it further and pick up with him in due course.
Seamus Logan.
Mr Speaker, many members in this place will be all too familiar with the trauma of a miscarriage. For some, this tragedy occurs more than once. Scotland is the first nation in the UK to implement a miscarriage patient charter based on the so-called Tommy's graded model of miscarriage care. Could the new Secretary of State, and I welcome to his place, could he outline whether the Westminster Government are considering replicating that system here in the rest of the UK?
Well, I thank the honourable gentleman for raising an incredibly sensitive and important issue in his question. We want to make sure that as a government, through the NHS, we're supporting women who suffer miscarriages and their families. We will make sure that we have the right provision in place to support them, and that the NHS and the wider health system is there for them when they need that help.
Sadiq Kumar.
Thank you, Mr Speaker. Dudley has high levels of deprivation and health inequalities. That's why I'm campaigning to bring healthcare on Dudley Town High Street. Can the Minister meet with me to discuss how we can leverage the 10-year plan to reduce these health inequalities in Dudley? And does he agree that we need a healthcare hub?
Well, I would definitely agree that my honourable friend is a formidable champion for her constituency, and she's absolutely right to raise the importance of making sure healthcare is easily accessible in places like high streets where people can access it easily. I'm very keen to make sure that the Neighbourhood Health Centres programme, 250 of which we've announced, 120 by 2030, are delivered as quickly as possible, and that's part of our plan to make sure that healthcare gets right into every local neighbourhood and community, and I look forward to discussing that further with my honourable friend in the future.
Sir Desmond Swain.
May I have a meeting to discuss my Parents, Carers and Babies Bill, which affords support to the Best Start Family Hubs and Healthy Babies programme?
I thank the honourable gentleman for that question. And we know that the earliest stages of a child's life are critical for their development, and the government is committed to supporting families to give babies the best start in life, and we are investing over £900 million in Best Start family hubs and healthy babies to create an integrated, accessible system of support for families. I particularly look forward to considering the merits of the Right Honourable Member's Private Members Bill that he presents to Parliament, and I would indeed look forward to meeting with him to discuss that further.
Dr Rupert.
There's 500,000 celiac sufferers in the UK, but there's little understanding of the condition that's massively underdiagnosed. So can I invite everyone here, even you, Mr. Speaker, to the drop-in that I'm doing on Tuesday the 16th with the campaign? And in particular, can they have a follow-up meeting with my honourable friend, the Minister, the member for Gateshead and Washington, as she has been a long-standing advocate and gets it.
Well, I thank my honourable friend and neighbour for her question today, and it's very welcome that she's raised this matter in the Chamber, drawing attention to so many members on both sides of the House. I don't want to speak on behalf of my honourable friend, but I'm getting a nod from my friend, the Minister. We should be happy to pick this up with you in future.
That completes questions. We've got statements, haven't we? We've got statements. Yeah, these points of order come after statements.
Thank you.
Take care. Now come to the urgent question. Gavin Robinson.
Thank you very much, Mr. Speaker. I wish to ask the Secretary of State for Northern Ireland if he will make a statement on reports of a serious, violent attack in North Belfast involving a foreign national and the implications for public safety, immigration enforcement and community cohesion.
Mr. Speaker, I'm grateful to the Right Honourable Gentleman for his question. Shortly after 10:30 p.m. last night, a man in his 40s was subjected to an horrific, sustained knife attack in a street in North Belfast. He is in hospital in a serious condition, having suffered very severe injuries. I know the thoughts of the whole House will be with him and his loved ones at what must be a time of unimaginable distress. The response from the Police Service of Northern Ireland was immediate. A man in his 30s was arrested on suspicion of attempted murder. He remains in police custody, and the PSNI are continuing to investigate. They have declared it a critical incident. But amidst the horror of what happened, we also saw something extraordinary. When confronted with scenes of terrifying violence, members of the public did not walk on by. Instead, a number of them stepped forward, and at immense risk to their own safety, they intervened to pull the assailant away and protect the victim until the police arrived. To those individuals, I would like to say this. You showed the very best of humanity, and you have the profound gratitude of this entire House. This was a horrific and brutal attack, and the PSNI are seeking to provide support and reassurance to the local community. The Chief Constable, to whom I have spoken twice this morning, and his officers have our full unwavering support as they pursue their inquiries. I would also like to repeat their appeal not to share or repost footage of the attack out of respect for the victim's family. Mr. Speaker, I echo the words of the Prime Minister this morning that there is no place for such violence on our streets. All of us have a responsibility now to urge calm and let the police do their job.
Gavin Robbins.
Mr. Speaker, can I firstly thank you for granting this urgent question. The attempted murder in Belfast last night was chilling. What has been seen by thousands already across the country cannot be unseen. It was medieval. The systematic mutilation and attempted slaughter of a citizen of Belfast on our streets. Mr. Speaker, my prayers are with the victim, and I similarly praise the brave man who, with a hurl in his hand, intervened to save his neighbour's life, and this House should praise him too. Mr. Speaker, what occurred last night will have profound implications for community cohesion in this country. This needs to be a time for honesty and openness and truth. Will he confirm that he and his government recognise that uncontrolled immigration needs to end? Will he confirm that the government needs to reassure and protect our population who for too long have had their concerns ignored? And knowing that he and the Chief Constable and I share a concern that there could be violence, and express my wish and our collective desire for calm, that community cohesion lies on the precipice. Will he confirm that the actions last night in no way reflect or represent the values of our nation? That the victim belongs in Belfast, but the attacker does not? Having abused the privilege of our nation, the perpetrator living in the UK under a 5-year visa needs to be convicted and deported on the first flight out on a one-way ticket.
Well, I would say to the right honourable gentleman, first of all, the footage that many people have seen is indeed truly horrifying. On his last point, as he will be well aware, any foreign national who abuses the hospitality of this country to commit crime should be in no doubt of our determination to deport them. We need to allow the criminal justice process to take place. On his question about net migration, as he will know, it is now down 82% from the peak reached under the previous government. But I would most particularly echo what he has said in appealing for calm, because we have seen previously in Belfast in August 2024 and in Ballymena in 2025 what happens after horrific incidents when there is disorder on the streets, because it is the communities that suffer, it is innocent people who suffer and whose lives can be put at risk. And that is why all political leaders have such a solemn responsibility to urge the calm that I have called for in my response to his question today.
Chris Moore.
Thank you, Mr. Speaker. Can I thank the Secretary of State for his statement, and can I also thank my right honourable friend for asking the question. As a member of the Northern Ireland Select Committee, I've visited Belfast on several occasions and have been struck by the incredible nature of the community spirit and the incredible city. What we witnessed last night is the worst of humanity, but also the best of humanity. I think it is incredible that bystanders came to the aid of that individual suffering a brutal attack. Can the Secretary of State assure me that the PSNI will be given every resource they need to conduct a swift investigation and ensure that all facts are shared with the public? And can we also ensure that those brave people who rush to the aid of one of our own countrymen is given the honour and the reward that they deserve for representing the best of our humanity?
Well, I say to my honourable friend that I know from the conversations I've had with the Chief Constable this morning that the PSNI are treating this, of course, as the House would expect, with the utmost seriousness and are pursuing their inquiries. We need to let the police investigation and in due course any criminal justice process take its place. I am in favour of as much information being shared as soon as possible, and I would report to the House, Mr Speaker, that the PSNI will be holding a press conference in approximately 5.5 minutes' time to provide more information about the incident. I also join my honourable friend in expressing hope that the bravery that we saw on the streets of North Belfast last night may in due time be recognised.
Minister Matt Vickers.
Thank you, Mr Speaker. I'd like to echo the Secretary of State's comments in condemning this dreadful attack. Last night's attack in North Belfast was horrifying, appalling and deeply disturbing. This was a brutal act of violence that will have sent shockwaves through the local community and caused huge concern across the city, Northern Ireland and the whole of the United Kingdom. My thoughts, and I'm sure those of the whole of the House, are with the victim whose condition has been described as serious. I also want to pay tribute to the PSNI and members of the public who displayed remarkable courage in stepping in to confront the attacker before the police arrived. The Police Service of Northern Ireland must be given the time and space to carry out a full and thorough investigation, and those responsible must face the full force of the law. However, given the understandable public concerns surrounding the incident, it's vital that the facts are established and we have the transparency that people deserve. Can the Secretary of State confirm the immigration status of the attacker? If, as is reported, the attacker is a foreign national, what steps will the Home Office take? It is urgent the facts are put on the public record to avoid speculation and prevent an information vacuum which the Independent Review of Terror Legislation has warned about. If there has been failings on our borders, this is yet another reminder that we do need stronger borders, and this is why we believe it is time to leave the ECHR. I encourage all who have evidence of the attack to come forward and support the PSNI in its investigation. I join the Secretary of State and all communities in condemning this horrific attack.
Secretary of State.
Well, I am grateful to the honourable gentleman for his comments and for the tone in which he expressed them, because it is, I think, very important that we act responsibly in these circumstances. I agree, as I've already indicated, that information should be made available to the public. The proper procedure in answering his very specific question is for the PSNI to be in contact with the Home Office, which I know they have been doing, in order to establish the facts around the individual. And I would anticipate, as I say, it's proper that the police provide that, as they are leading the investigation. And I anticipate that more information will be made available shortly by the PSNI, is the right and proper approach. I would have to say, however, I do not agree with what he said about the European Convention of Human Rights. It's very important. We have it because it protects the liberty of all of us.
Dr. L. Pinkerton, Liberal Democrat spokesperson.
Thank you, Mr Speaker. The reports from Kinnaird Avenue are indeed deeply distressing. My thoughts are with the victim and with his family. I pay tribute to the residents who did the extraordinary thing of running towards danger, intervened to restrain the attacker and help protect another person's life. I also thank police officers and paramedics who responded with such speed and professionalism. Their actions almost certainly saved a life yesterday evening. What I know of North Belfast is that it's a community that has worked hard to build trust across long-standing divides, and that residents will be as horrified by this attack as the rest of us. Will the Secretary of State reassure residents that they will be kept safe in the days ahead, confirm that the PSNI have the support that it needs to maintain a visible presence, and make clear that no one should exploit one individual's actions to cast suspicion on a whole community?
State. Well, I agree with the honourable gentleman in everything that he said, and I know that the PSNI is working hard to provide reassurance to the local community and to make arrangements for that reassurance to be visible. In the face of those, let us be frank in this House, who will wish to use this terrible event to stir up trouble and to seek disorder on the streets of Northern Ireland. And I say that because we have seen it before. We do not wish to see it again, and that is why all community leaders, politicians and others have such a responsibility to call for the calm that he himself has so eloquently called for.
Jim Shannon.
Thank you, Mr. Speaker. Can I, first of all, thank the Secretary of State for his well-chosen words, wise words as well, and for his answers. Tensions are inflamed, and at this moment, I'm aware of planned protests throughout my constituency of Strangford. And I'm also aware that many of those who intend to attend do so not because they are frightened for their family alone, but instead feel their fears are ignored when they make a good and grand statement. So how can the Secretary of State and this government ensure that people from Portavogie to Newton Ards know that their right to peacefully protest is respected, but more than this, that their government, my government, will make changes for safety reasons as a matter of urgency? Thank you so much.
Okay.
Well, I join with the honourable member in reasserting the right of every citizen of our country to protest peacefully. But we have seen in the past that there are those, provoked by others, who sought to use that opportunity to then promote violence and disorder. And I join with him in saying peaceful protest, of course, everyone has the right to express their view. But in the end, if we want to support the PSNI, the last thing people should be doing is stretching their resources across Northern Ireland to deal with protests that aren't going to help anyone and are not going to assist in the furtherance of this investigation, so the perpetrator can be brought to face justice. That is the way we do things in our country, is it?
Jim Allister.
Thank you, Mr. Speaker. We're all shocked by the sheer savagery of this attack, and indeed the only bright spot in this orgy of violence was the brave intervention of local citizens whose courage we salute. But what I want to know, and what I know my constituents want to hear, is what will be done to stop the importation of an alien culture that thinks it's appropriate to try and behead someone within the United Kingdom. And on the immigration status of this person, did they hold a visa before they came to the United Kingdom? Did they obtain a visa having come illegally to the United Kingdom? I think we're entitled to know. And I do say to the Secretary of State, this House should be getting its information from the Secretary of State, not from the press conference of a Chief Constable. And I think the House is entitled to know, because there's truth and transparency, which is the greatest antidote to rising tensions. So can we have the answers?
Secretary of State.
Well, I would say I'm sorry that the honourable gentleman used the word alien culture, because what exactly is he referring to? What the British people have had enough of, are anyone from wherever they come, whatever their background, who seeks to commit violence on citizens of the United Kingdom. That is what we together are strongly opposed to. There is a proper procedure that needs to be followed in relation to the release of information. It is a live investigation. I think it is right and proper that the police lead on that, and that is why it is the police who have been in touch with the Home Office and will provide further information. And as soon as I am also able to update the House, I will do so. I am also in favour of as much information as possible being provided once process has been followed to make sure that it can be confirmed.
Julian Lewis.
Whilst I agree with virtually everything the Secretary of State said in his opening response, I really am baffled by his refusal to share with the House a piece of simple information. Did this person come legally into this country and has a 5-year visa because he came legally, or was he given this visa after entering the country illegally, this information will come out sooner or later. And what we have learnt from similar terrible incidents like this is the longer it is withheld, the worse the rumour mill goes into action.
Well, I do understand the last point that the Right Honourable Gentleman makes, but it is very important in these circumstances to be absolutely sure about the facts before they are released. And the proper vehicle for doing that is the PSNI being in touch with the Home Office, which is what has been happening this morning. As the Right Honourable Gentleman may be aware, the police originally said they believed him to be of one nationality. It may well turn out that he is in fact of another nationality, which does demonstrate the point I'm trying to put to the House, that it is important that the police lead on that so that the full facts can come out and then they can be made available to the House and to the country.
Lee Anderson.
Mr. Speaker, of course, the Secretary of State will know the answer to this question. Did the assailant enter the United Kingdom as an illegal migrant stroke asylum seeker?
Well, until I am in a position, by talking to the Honourable Gentleman's asked me a question, would he do me the courtesy of allowing me to answer it? Until I am in a position to have that confirmed, I cannot confirm it to the House. As soon as I can, I will. But as I've already explained, it is the PSNI that is leading on answering the very legitimate question that he has asked.
Robin Swan.
Thank you very much, Mr. Speaker. The Right Honourable Member for East Belfast described this incident as medieval. It wasn't just medieval, it was pure evil when we saw what happened on the streets of the United Kingdom. And while tribute has been paid for those members of the general public who stepped in and the emergency services that responded, can I also seek a reassurance from the Secretary of State that those members of the general public who stepped in will actually be recognised and not be persecuted or prosecuted for the actions that they actually took in regards to attacking that individual? And can I also encourage the Secretary of State to come forward and fill the vacuum of information that's out there, because he does know more than I think he is telling the House at this minute in time in regards to this incident?
It was an act of pure evil. I agree with the Honourable Gentleman in saying that. I'm surprised that he suggests there's any possibility of those who came to the aid of the victim should be at risk of prosecution because they were trying to save him when judging by the footage, when the attacker was trying to inflict great harm upon him. And my judgment, having looked at that, is what they did was proportionate and fair. But that is for others to judge. It is important that they are recognised. I've already indicated the House. As soon as I have information that is confirmed and which I can be sure of, I will inform the House.
Gregory Capp.
Thank you, Mr. Speaker. Tens of thousands of people are horrified at the circulation online of the video that the Secretary of State has alluded to. And while he quite rightly congratulates the members of the public who intervened, and they did, whether it was a hurled bat or a cricketing bat, they took action. But what we need to see now, as tension rises, we need to see government action to restrict and inhibit people arriving in this country illegally, some of which carry out the actions that we saw on the streets of Belfast last night.
Well, the Honourable Gentleman will be well aware of the action that the government is taking to deal with illegal migration. And I've also made clear to the House the steps we take if anyone, however they came to the country or whether they are from this country, commits a criminal offence, they will face due process. And any foreign national, regardless of how they came, who abuses our hospitality and commits crimes, can expect to be deported at the end of their sentence.
Cole Lockhart.
Thank you, Mr. Speaker. My thoughts are very much with the victim of this horrific attack last night, and I want to also echo the calls for calm in our communities. Communities in Northern Ireland are angry, they are demanding answers, and they deserve answers. Sadly today, I don't feel they're getting those answers, and it's not lost on the people of North Belfast, who is in this place today speaking up for working class communities who are very concerned about uncontrolled immigration and the fact that many houses now, that mayors won't even tell how many houses they have full of immigrants. So my question is, was this individual known to the authorities? How many other from the same country are currently being accommodated in Northern Ireland? How did they enter the UK? And what action this government is taking to prevent abuse of our immigration system, including via the land border within the Republic of Ireland?
Well, I say to the honourable member that the public are right to be angry about what they witnessed in that appalling video and what they have heard about the attack that took place. As I've already indicated to the House, I mean, some of the questions that she's asked, I will endeavour to come back to her on. Others will be provided in due course once the facts have been checked. It's really important that the facts are checked before information is given to the House, because I wouldn't want to stand here and say one thing and it turns out that is not the case. So checking that thoroughly is a responsibility on me before I inform the House, and that is what I intend to do.
Carl.
Thank you, Mr. Speaker. Can I also echo the sentiments of members in this House in sending my thoughts and prayers to the victim of this horrific attack? And in specific, can I also extend my gratitude to the local community who bravely intervened? What we all must do now is encourage calm at this most troubling time and stop tensions from further being inflamed. And to that end, does the Minister agree that we must not let the heinous actions of one person be taken as an opportunity to taint an entire community, and that we should not and must not attempt to fill the gaps whilst the story and the police investigation continues to deliver justice to the victim and their family?
Well, I do agree with the honourable gentleman when he says that. And when I think back to those who were attacked in the wake of the terrible events in Southport and then in Ballymena, we know that in Northern Ireland, certain of individuals were attacked. It had nothing to do with any of this, simply because of the colour of their skin. And that is not what this country is about. Identify an attacker, due process in due course after investigation. Do not cast aspersions on a whole community. Many people from all backgrounds contributing so much to our national life.
Joker Adam.
Thank you, Mr. Speaker. I thank the Secretary of State for that answer. And following on, I myself also give my deepest sympathies for the victims and his family and pay tribute to the bystanders who intervene at this horrific case. Does the Secretary of State agree with me, as he has already expressed, further that crime and heroes come in all different hues and colours, like we have seen in Cambridgeshire in the train, as the stabber of the Saudi student in Cambridgeshire in the picturesque streets last year. It doesn't matter which background you come from, and it's a responsibility for members in this House to temper their inflammatory remarks so we do not see actions like we did last week in Southampton, where innocent police officers are having to go into hiding.
Well, I would say to the honourable member, we all have a responsibility by our actions and our words not to inflame. And we all have a responsibility, as I indicated in answering the Right Honourable Gentleman's original question, to plead for calm in these circumstances. That is the right thing to do on behalf of all the people of Northern Ireland.
Richard Tice.
Thank you, Mr. Speaker. Calm is essential after this horrific, brutal attack. We all know that. The Secretary of State has referred to further information coming out as we speak. Will he therefore commit to returning to this House later today, if possible, to update the House on the important information around the suspect and any other information?
I'm very happy to say to the honourable gentleman, I will report to the House in an appropriate form as soon as I am able to do so.
Right, that completes the questions. Let the front benches change over. We now come to the statement. Foreign Secretary Vet Cooper.
Thank you, Mr. Speaker. With permission, I would like to make a statement on the Middle East, first on the Iran conflict and Lebanon, second on the situation in Palestine. And can I apologise to the Shadow Foreign Secretary and also to the Speaker and to the House for the delay in sending across the copy of the statement. Mr. Speaker, this weekend we saw worrying and dangerous escalation. Lebanese Hezbollah continuing to fire into northern Israel, Israeli strikes against southern areas of Beirut, and the direct exchange of missiles between Iran and Israel, presenting one of the most dangerous moments since the fragile ceasefire was agreed. Over the last 48 hours, we have made clear the need for urgent de-escalation, because a resumption of conflict is in no one's interest, and I spoke to the Iranian Foreign Minister on Sunday evening to convey this directly. Both Israel and Iran have indicated that they have ended their strikes, and that is welcome, but there was some reporting just before I entered the chamber of strikes again this morning. It's vital that we have a diplomatic way forward, both to end the conflict in Lebanon, to reopen the Strait of Hormuz, to restore regional stability and prevent Iran ever developing or obtaining a nuclear weapon. As we have previously made clear in this House, Israel's recent escalation in Lebanon was reckless and disproportionate and deepened the humanitarian crisis that has already seen more than 1 million Lebanese people driven from their homes and thousands killed. But we strongly condemn Hezbollah's attacks against Israel, including its northern communities, because at Iran's instigation, Hezbollah, a proscribed organisation, is dragging Lebanon into a war that is against the interests of its people and its government. It must end this dangerous attacks and disarm. And the US-brokered ceasefire in Lebanon must be properly observed by all parties. We want to see a swift and successful conclusion to the ongoing talks between the US and Iran. We need an agreement that gets the strait fully open with no tolls or charges. And last week I discussed this with Foreign Minister Wang Yi in China and Foreign Minister Jaishankar in India. Every country has a stake in freedom of navigation, and the UK will continue to speak up for this across the world. And in partnership with France and other countries, we stand ready to play our part once agreement is reached to support demining and provide reassurance to shipping through a multilateral maritime mission. With cost of living pressures at home, we need a lasting settlement which delivers peace and stability in the region and the full restoration of global trade. Let me turn now to Palestine. 9 months ago at the UN General Assembly, I confirmed the UK's historic decision to recognise the state of Palestine. And we did so alongside partners in recognition of the inalienable right of the Palestinian people and to defend the viability of a two-state solution. We did so as part of a wave of international diplomatic energy in support of peace in the Middle East, and it was a crucial moment of hope that we could end the violence and suffering and begin to build a better future of lasting peace and security for Palestine, Israel, and the wider region. But today the situation is bleak, and the viability of the two-state solution remains in grave peril. Let me turn first to Gaza. The ceasefire remains formally in place, but it is being regularly violated. Since October, over 900 Palestinians in Gaza have been killed. 1.9 million Palestinians remain displaced and dependent on humanitarian aid, and aid is down this year, not up, with 90% of water and sanitation infrastructure destroyed and not rebuilt, families without shelter, a public health crisis with rodent infestations and communicable disease, and currently at barely half the level of the 4,200 trucks a week promised in the 20-point plan. Israel's registration law continues to severely restrict international NGO operations while key crossings remain closed. And it is a total moral outrage that children are still going hungry while food they need rots on shelves because aid agencies cannot get in. Meanwhile, Hamas decommissioning has not yet started, and they retain a tight hold on areas of Gaza. And instead of the phased withdrawal of Israeli troops, Gazans are restricted to just 40% of the territory, unable to access their land beyond the yellow line. And Mr. Speaker, we urgently need new international energy, new pressure and new action to resuscitate the 20-point plan. For the UK, that means pressure in 3 priority areas. First, increased aid is urgent and must be unconditional. Despite all the challenges, UK aid is making a difference on the ground. Last year, we provided over £80 million of humanitarian and early recovery funding, with funding protected again this year, enabling 650,000 people to receive food and improving access to water, sanitation and hygiene for 300,000 people. UK support for mine clearance has enabled 45 acres of land to be made safe for community use and helped clear 24 key sites, including medical facilities. And today I can announce another further £1 million to support these mine clearance efforts. But some UK aid is still stuck in warehouses, including in Jordan and Egypt. And humanitarian support is a fundamental right. It cannot be bartered against other aspects of the peace plan. So the Netanyahu government must recognise its urgent humanitarian responsibility to open crossings and to end the arbitrary restrictions so the UN, UNRWA and international NGOs can fulfil their life-saving mandates. Second, we continue to press for the decommissioning of Hamas weapons to get underway. Hamas must destroy its terrorist infrastructure and weapons production sites as a first step towards full demilitarisation. And we have offered UK technical expertise to support this. Meanwhile, Israel must deliver on its commitments to withdraw. And third, we need the practical support and access that was promised for the Transitional Palestinian National Committee. There are still too many obstacles in its path, and it is still not operating within Gaza itself. That makes it easier for Hamas to retain its hold. We've offered practical support to the committee as they endeavour to fulfil their mandate, and we will lead international calls to support them in coordination with the Palestinian Authority, because Palestine should be run by Palestinians. Which brings me to the West Bank. Following to the ceasefire agreement, I warned that sustained peace would not be possible without a comparable effort to protect the viability of Palestinian statehood and rights in the West Bank. Instead, we have seen the opposite. Last week, a 7-month-old baby was killed in his mother's arms. His name was Sam Abul Haikal, after the IDF opened fire on a family car in South Hebron. And the UK supports the calls for an immediate and transparent investigation and robust accountability. Over the weekend, a gunman in Israel opened fire, with 1 killed and 5 injured, an attack that shockingly was applauded by Hamas. We've also seen rising and incredibly disturbing settler violence. Palestinian families and communities driven from their homes, brutally beaten while farming their own land. 950 violent incidents this year already. In April, settlers shot dead 2 Palestinians while attacking a school, and 1 was a boy of 14. Mr. Speaker, the UK condemns this shocking violence which terrorises Palestinians. Many Israelis are horrified at what they are seeing from settler extremists. The Netanyahu government has condemned some settler violence, but that rings hollow when there is scant accountability and when the agenda of the hardline settlers has now become intertwined with the approach of this Israeli cabinet. So let me set out today new action this government will take. First, I'm announcing a new wave of sanctions targeting the networks that are supporting this violence. Organisations including the Farms Association that fundraises for illegal outposts, strongholds for settler aggression. A Harvad Gilad that serves as the Farms Association's financial conduit. And Artsenu that has fundraised for military equipment for armed settler squads. This is the 4th package of sanctions under this Labour government against extremist Israeli settlers. We have targeted some of the most notorious individuals, the most significant settler entities, and the extremist figures in the Israeli cabinet who are inciting these acts. Today's measures mean the UK is second to none among international partners in targeting those facilitating and inciting settler violence. We're also going further. On the 22nd of May, the Prime Minister led a group of other world leaders warning businesses not to bid for construction tenders for E1 or other settlement developments. But this is not just about construction contracts. So today, alongside the Department for Business and Trade, I have strengthened our business risk guidance to make it clear and unambiguous. If you are a British citizen or business, you should not conduct any economic and financial activities in illegal Israeli settlements. And today, alongside my Right Honourable friend, the Culture Secretary, I have written to the Charity Commission for England and Wales requesting that they open an investigation into evidence of UK charities that have links to illegal settlements. The Minister for the Middle East will meet with the Commission's CEO tomorrow because no UK charity should be supporting or enabling these breaches of international law. The principles we're acting on, I believe, are widely supported across this House. We believe that settlements are a fundamental barrier to peace and a flagrant breach of international law. We believe that violent settler groups should not be profiting from the land that they have seized from Palestinians. And we also believe we must continue to distinguish and protect trade with people and businesses across the State of Israel, trade that reflects long-standing and important ties between our countries and communities. We will look to continue to coordinate our approach with close allies and look at further concrete steps to counter settlement expansion and promote peace and security. Finally, let me address our support for Palestinian governance. We are keeping up the pressure on the PA, the Palestinian Authority, to deliver its vital reform commitments on education, welfare payments and elections. We are expanding the direct practical help to the PA to reform and to deliver effective government for its people, drawing on the deep expertise of the UK envoy for PA governance, Lord Michael Barber. But the PA faces an enormous fiscal and healthcare crisis because the Israeli government has a stranglehold on the Palestinian economy, including withholding $5 billion of Palestinian tax revenue. That means schools and health facilities struggle to stay open for more than 1 or 2 days a week. An effective PA is directly in Israel's interest. It is both utterly wrong and incredibly short-sighted for the Netanyahu government to seek to undermine it at every turn. So the UK has stepped up our efforts in support. Alongside the support for reforms, this year we provided PA funding that helped 5,300 health workers sustain frontline services. And today I can announce we'll provide at least £10 million further to support the PA over 2026 to pay salaries, bolstering the PA's ability to function, helping dedicated health professionals to do their essential work across hospitals, clinics and maternity services. And our focus will be to build more effective, more democratic and more accountable governance and to reinforce the unity of the West Bank, Gaza and East Jerusalem as inseparable pillars of the State of Palestine. International pressure and partnership on the ground have been vital over the last 12 months. And so later this week, I will travel to Paris along with other foreign ministers in advance of the Peacebuilding Conference, which is bringing together Israeli and Palestinian civil society groups alongside international partners dedicated to advancing the two-state solution. Because the momentum of last year must be reinvigorated for the sake of peace and security for all. I commend this statement to the House.
Dame Priti Patel, Shadow Foreign Secretary.
Mr. Speaker, Iran is the world's leading state sponsor of terrorism, and it's now over 100 days since this conflict began, and yet Iran continues to pose the most dangerous and significant threat to the Middle East, peace and security, and to the interests of Britain and our allies and friends in the region. In recent days, we have seen the most appalling Iranian attack in Kuwait, causing injury and death at Kuwait International Airport, and launched missiles towards Israel. They continue to obstruct the movement of goods through the Straits of Hormuz, seeking to hold us all to economic ransom. They refuse to end their nuclear weapons program. They carry on oppressing their citizens, having butchered thousands already this year. And they continue to sponsor and support terrorist proxies throughout the region, causing bloodshed from Lebanon to Yemen to Gaza. They've shown no interest at all in pursuing peace, and they laugh in the face of sanctions. No one in this House should have any shred of sympathy for the Iranian regime, which has caused so much terror and has blood on its hands. Iran has been the root cause of immense suffering in the Middle East for far too long, in places where it has no business whatsoever. And as the President of Lebanon has said in recent days, Lebanon is not Iran's country. Mr. Speaker, Madam Deputy Speaker, can the Foreign Secretary confirm whether British assets in the region were involved in any interception efforts over the weekend? And what does this latest attack mean for our defence posture in the region? It's all very well for the government to call on Iran to exercise restraint. That has never stopped them from carrying out the hostile attacks that just keep on increasing. So will there be any material consequences from Iran from Britain, like a new wave of sanctions to further up and ratchet the pressure? On these benches, we've been calling for new sanctions to prevent senior figures in the despotic Iranian regime parking their wealth in London, and to ensure that Britain cannot be a sanctuary for enforcers of repression if those linked to the regime seek to flee Iran. So will the Foreign Secretary commit to taking both of these actions? And as I said in the House last week, Iran's terrorist proxy Hezbollah must be disarmed. It has caused immense suffering in both Lebanon and in Israel. We need to see UN Security Council Resolution 1701 implemented in full, and Hezbollah must comply. When I raised this in the House last week, the Minister for the Middle East said in response that it must be the Lebanese government who disarm Hezbollah, and he is absolutely right. But he didn't say what support Britain is actually giving to the Lebanese government now, because we all know that they cannot do this on their own. Is the government going beyond the traditional support Britain has offered the Lebanese armed forces and, for example, offering technical and intelligence assistance? The Foreign Secretary has said nothing in her statement on disarming Hezbollah, so can she tell the House today what the government is doing? And more broadly, Madam Deputy Speaker, we hope the ceasefires in the region can lead to a sustainable end to the conflict without a resumption in fighting. But clearly, we all know this remains incredibly precarious. Specifically on the Iran ceasefire, can the Foreign Secretary update the House on what involvement, if any, the government is having behind the scenes in mediation efforts? Has she personally seen the outline of the apparently close peace deal, or has had any input into it? And has she discussed this at all with Secretary Rubio? Madam Deputy Speaker, the Foreign Secretary has today announced a package of measures regarding the West Bank, Gaza and the 20-point peace plan. We all want to see an end to violence and conflict in the West Bank and in Gaza. And in particular, she's made very important points on aid and the fact that humanitarian aid and support is not getting through. Can she state what else the government has been doing to have critical discussions with the parties involved to see progress in this area? And can the Foreign Secretary tell the House what the changing guidance on change will actually trade will mean in practice and the practical efforts of these sanctions that have been announced today? She's mentioned asking the Charity Commission to investigate certain charities. Can she tell us what evidence she has that has prompted this particular request? And will she be asking the Charity Commission to investigate charities in the UK that are supporting Iran and terrorism? And on the Palestinian Authority, is the £10 million announced new money or from existing resources allocated? And can she give an update on the steps being taken to reform the PA and stop the pay-to-slay mechanisms? Madam Deputy Speaker, Iran is not alone and is backed by the authoritarian axis that we all speak about too much in this House. The Foreign Secretary has just been to one of those states, China, in the whole desperate attempt now for economic crumbs to bail out Labour's disastrous handling of the economy. The House is fully aware of China's role in supporting Iran, including providing offensive capabilities. The FCDO press release during her visit states that she stressed the urgency of reopening the Straits of Hormuz without tolls or charges, preventing nuclear proliferation in Iran and maintaining stability in the wider Middle East. But did China's foreign minister show any willingness to put pressure on Iran to reopen the Straits and to stop the illegal and reckless attacks that we are seeing? Did she raise with him concerns over China's enabling of Iran's offensive attack? And there was no mention in the Foreign Secretary's statement or the press release from the Foreign Office of Jimmy Lai, which raises very significant questions for his family. Did the Foreign Secretary call for his immediate release and for an end to his politically motivated show trial? Did she threaten consequences if this did not happen? Finally, Madam Deputy Speaker, and without wanting to segue too far away from the Middle East, the Foreign Office also claims that the Foreign Secretary urged China to end its economic support of Russia's illegal invasion in Ukraine. But will any undertakings be forthcoming? China is a critical enabler of Putin's war, and we cannot simply turn a blind eye to this.
Foreign Secretary.
Thank you, Madam Deputy Speaker. So let me begin with the points that the Shadow Foreign Secretary raised on Iran. We agree, I think, on the dangers and risks from Iran. We have seen the threats and the strikes, that unprovoked strikes against the Gulf, against Gulf partners of ours, attacks on civilian infrastructure and energy infrastructure as well, and as well as the operations and attacks through proxies across the region, but also more widely, and including the attacks on Israel as well. That is why we have extensive sanctions against Iran. It's also why we have always been clear, under no circumstances must Iran be allowed to get or develop nuclear weapons. And it is why the UK, along with France and Germany, led the approach to the snapback restoration of sanctions against Iran in the autumn at the United Nations. We have also, because we recognise some of the threats from not just Iran, but also other state-backed organisations, including threats here in the UK. And that is why we have been working intensively, led by the Home Office, to draw up state threats legislation, which we hope will be able to pass swiftly through the House as well. She raised the issues around the business advice is about being very clear too, so there can be no doubt. This is not just about the construction of the E1 settlements, as raised by several government leaders, world leaders, to discourage any settlement, any involvement of businesses in the construction, but also more widely to be clear that the business advice is against any economic or financial activity in those illegal settlements, because they undermine the prospects for peace and security for Israel and Palestine alike. She returned to the issue about the Straits and the potential for an agreement. We desperately want to see an agreement take place. We are keeping in close touch with all of those involved, including with the mediators, as well as I have had many discussions with Secretary of State Rubio. We are not direct participants in the negotiations. That is directly for the US and Iran and the mediators, but we are doing anything that we can to support that process and to pursue as well a settlement that ensures not simply a partial opening of the Strait, but the full recognition of the principle of freedom of navigation and the underpinning of international law. And as a maritime trading nation, that principle is one that we should always be championing. And that is why I have directly raised that in China and in India, and specifically have been discussing with them the importance of maintaining that unconditional support for freedom of navigation. They have, both in the discussions, including in China, recognised the importance of no tolls on the Strait of Hormuz, and I have, of course, urged them to put any pressure they are able to put on Iran in order to comply and to come to this agreement. She raises Jimmy Lai. Yes, of course, I raised Jimmy Lai. We want to see him released urgently and have made that position very clear in this House, made the position very clear again with the Chinese authorities, and will continue to do so. And I will also be keeping close touch with Jimmy Lai's family on this as well, because we take the case so seriously. And then she also raised the issue around Russia and Ukraine. I have to be honest, we have a difference of view with China on this one. We have strongly been clear about the importance of our total solidarity with Ukraine, with its people, because ultimately Russia's threat to Ukraine's security is also a threat to Europe's security and is also a threat to the UK's security. And again, I have made those points very clearly to the Chinese government, and also as part of my visit I've also raised those issues directly with the Indian government as well, who also take a different view to the UK on this crucial issue about Russia and Ukraine. But we will continue to make those points. And to be honest, I would say to her, I actually think it is really important as part of our security that we engage with the countries around the world, some of the biggest countries around the world, on those global security issues. And because this is not simply about economic or trading relationships, this is actually about our security. Our security is strengthened if we engage with, for example, China on these issues, whether it be on the Strait, whether it be on issues around Russia, Ukraine, and we do so in line with our principles, in line with our commitment to international law, and we will raise those differences and disagreements, but we also need to do so in the interests of our security and keeping people safe at home.
Chair of the Select Committee, Dame Emily Thornberry.
Thank you very much, Madam Deputy Speaker. I welcome the Foreign Secretary's statement, and I share the Government's condemnation of the illegal settlements that are systematically destroying any prospect of a Palestinian state. And of course, Madam Deputy Speaker, settlements don't build themselves. They require money and insurance and trade. So I welcome the changing guidance telling British citizens that they shouldn't conduct any economic or financial activity in the settlements. But the question really is, what happens if they do? Currently, the truth is that British companies are bankrolling annexations one settlement at a time. So surely, if the government can recognise that settlements are illegal, then why not just issue a ban on all trade and goods and services with the settlements rather than more guidance? Are we in danger of doing too little too late?
Secretary.
Well, we are clear that settlements are illegal and are undermining peace. We do not want trade with illegal settlements, and we want to deter support for those settlements, and that includes financial engagement and also includes the charitable organisations who should not be engaging as well. That is why we have set out new sanctions today and stronger business advice. Clearly, of course, we distinguish between illegal settlements and trade with businesses and organisations across Israel. And we will also continue to work with allies across the world on this. I recognise the points that my honourable friend has made, and I would say I know that countries who have looked at this have also found it hard to do some of these other further issues in practice, but we will continue to work with allies on what the practical arrangements are that can ensure that we stand up for international law and against these dangerous, these illegal settlements that are endangering peace.
Liberal Democrat spokesperson Callum Miller.
Thank you, Madam Deputy Speaker, and to the Foreign Secretary for advance sight of her statement. The steps announced by the Government today are important and right. British businesses and charities have to know that engaging with or sustaining settlements in the West Bank is illegal and unacceptable. So the updated business risk guidance is correct, but it is overdue. The Dutch government issued a similar discouragement notice in 2006, 20 years ago. It is also insufficient. The government should have used this moment to set out specific sanctions on British firms which enable or finance the expansion of illegal Israeli settlements. So will the government move to review sanctions much more regularly and bring new packages to this House every month? And will the Foreign Secretary finally heed Liberal Democrat calls to ban all trade in goods and services with the illegal settlements? Madam Deputy Speaker, last September, this government took the historic decision to recognise the State of Palestine. That was the right thing to do, and a step which Liberal Democrats have been advocating for almost a decade. But the Israeli Security Cabinet is moving fast to expand legal rights for land purchases in the West Bank, while settler violence towards Palestinians continues. The UK's complicity in enabling the growth of illegal settlements runs deep. This Sunday, the Great Israeli Real Estate event is coming to London. Properties in illegal settlements in Gush Etzion are being marketed alongside properties in Israeli cities. This is Palestinian land being advertised, bartered and sold on the streets of our capital. So will the government intervene to ban the event unless assurances can be made that no properties in illegal settlements will be advertised? Madam Deputy Speaker, turning back to the wider region, Hezbollah has continued to strike northern Israel, but the latest exchange of fire between Israel and Iran following Israeli strikes on Beirut shows just how precarious the regional ceasefire is. Talks towards a peace settlement cannot be derailed. So does the Foreign Secretary agree that IDF actions in Lebanon directed by Netanyahu are materially undermining the chances for reaching a wider peace settlement? And what actions are the government taking to address this? Finally, Liberal Democrats have long called for the prescription in the UK of the IRGC. The government has now committed to legislate this session. So will the government engage across the House to see whether this law can be brought forward immediately and fast-tracked into legislation?
Foreign Secretary.
Can I thank the honourable member for his comments, including on the importance of the recognition of the state of Palestine. And we should always be clear that there is no alternative to a two-state solution in terms of establishing any peace and security in the region. And that is why it is crucial that we work to maintain the prospects of a two-state solution now. He refers to the sanctions regimes, and we are looking not just to continue to increase sanctions and targeted ones, but also at potential ways to strengthen the overall sanctions regime as well. What I would say to him is we have been one of the leading countries in the world on sanctions around the illegal settlements. He will know we were one of the few countries who have actually sanctioned individual Israeli cabinet ministers who have been inciting the extremist behaviour and settlements, and where, of course, we saw one of those cabinet ministers in the most shameful behaviour around the Gaza flotilla in recent weeks as well, and the treatment of people there. He raised the issue more widely about going further in terms of the trade issues. Again, I would say what I said to my honourable friend. We have been very clear. We do not believe there should be trade with the illegal settlements. We have been clear and extremely strong in the advice that we are giving, and we will continue to work with allies across the world on the most effective way to maintain this. It is also important that we differentiate between illegal settlements and between the trade with businesses and organisations across Europe. On the issues around the threats, obviously, from Hezbollah, it is devastating to the people of Lebanon who have seen Hezbollah as an Iran-backed proxy hijack their chances of peace. But we have also, including my honourable friend, the Middle East Minister, has raised in this House as well, our deep concern about the Israeli escalation in Lebanon and the dangerous impact of that on the Lebanese people as well. We want to see the settlement between
Hi Michael, it's just running who I have no qualified joining in here, so I'm trying to set up speak already that there was not too much here. It's inside and I'll keep you updated. I'm going to find the court as much as the press but I would just keep you there was no car park. Okay, I'll keep you posted. No problem. I'm in yeah, I have family or something, so try to go off talking now. Yeah, it is. Your family home? No, it's when just family holiday home about 20 years ago. Like I want to yeah, especially when I was the way it has been the last couple of weeks.
No, I changed my mind. I'll do that. Sorry.
No worries.
Thank you.
Sometimes you'll find yourself training it 3 times.
Haze. Too young for one, right?
One, two, 1, 2. 1, 2, 1, 2. Talk about this level, hopefully. Fingers crossed. You know white balance, Davey? Yeah.
No, you're ground.
Which is what I love.
I know. That's not texting someone. That's not texting.
No, it's alright.
Who else? I know celebrities.
Facility in the group, take that, Robbie Williams.
Just keep that thing. Are you sure she wants that? That's a big thing. What age is she? On stage.
She's got in your champagne. She heard it at the Jeffrey. You know what? I think you very well because the way you're using. When you get the 25, like it'll look just fine.
Right, well, if he gets back to you, make sure you video it. I was just making sure she's okay with doing that in public.
Oh, I hope so. I love you, God, Mitch, I gotta go and video it.
I'll go.
Remember, sugar, sorry, sugar. Golly, sugar, we'll be there. Where's she from?
Don't tell him no more.
You're on the ground.
You being serious though? Huh? You being serious?
Yeah. She's there. She's a scratch.
I'm not joking at my own.
And you're shabby. So you're pretty.
No. I'm not even that good at spelling. And you've seen it straight away. And that was the list we got. Lauren, Shore, Banner, Way, Carrisford. What's it all? Probably now, right? You take back this up and shoot down and you do what you said. I think it was farmers. They have to do their bit. That's what I'm from. Down and over. And then that's the airport road. Yeah. And then at the top of the road, around that way. That's right. I don't know where oh, no, I don't mean that. I look at my old yes, yes, yes. You could hear this somewhere. Or even if there's something I'm going to have even if it's somewhere across 6 o'clock.
Somebody took control of it, Stu. It's gone up and down. I will do. I can't see. What's it sitting at the minute?
live yet? No?
Yeah.
Let's get some water here. Just a second. Oh, yes. Okay. Just let me get some water here for this. Sorry, just going to get the running order. Who wants to ask a question just before we start here? Okay, UTV, HTV, BBC,
GB News.
RTE, sorry,
GB News.
GB, Reuters, BT, Cool FM. I'm going to move this. I'm going to need to move. Okay.
You ready?
Hold on just 2 seconds, I'm going to get some water. So just at the minute, with UTV, BBC, RTE, GB News, Reuters, BBC, or BT and Cool FM. Okay, we're going to try and get us to all these questions. We're going to see how quickly we can get it. Right, okay, we're going to see how quickly we can get it. You're not seeing this separate there. Okay, so. All right, okay. Okay, right, SEC Senator for SEC Henderson. Apologies, gonna come in and do some media. Thank you.
Good afternoon, everyone, and thank you for coming to police headquarters this afternoon. Today I'm providing an update on the police investigation on the attempted murder in North Belfast. This morning, many people have awoken to the very distressing news of this brutal attack, and my first thoughts and that of my colleagues are with the victim and his family. Detectives and specialist officers are supporting them at this very difficult time. The man, who is aged in his 40s, was seriously injured in this knife attack. And it's important to acknowledge at the very outset the bravery of those members of the public who ran towards danger to intervene and help the injured man. Our position is to provide as much verified information to the public as possible as our investigation continues. This is what we know so far. The incident happened in the Kennard Avenue area on Monday the 8th of June at around 10:30 p.m. Officers arrived at the scene within minutes of the report to detain and arrest the suspect and to administer first aid. Colleagues from Northern Ireland Ambulance Service attended a short time later. The victim was taken to hospital with significant injuries to his eyes and serious slash wound injuries to his back and face. The suspect, a man in his 30s, who we now understand to be Sudanese, was arrested at the scene on suspicion of attempted murder. He is in custody, and at this time we are not seeking anyone else in connection with the investigation. And what is believed to be a kitchen knife was recovered at the scene. I share the public's revulsion over the brutal nature of this attack, which has created concern not only here in Northern Ireland but much further afield. And I understand also that there will be questions regarding the nature of the attack. Throughout today, we've been liaising with senior counter-terrorism partners. At this stage, we have no information to suggest that this was a terrorist-related incident. However, I must stress we are still at the early stages of our investigation. This brutal attack has sent shockwaves through our communities, and I want to reassure all of our communities your safety is our priority. And we're currently engaging with local representatives and residents to provide reassurance and support. That is why today the public can expect to see an increased police presence across Northern Ireland this evening and in the coming days to help support, reassure and keep all of our communities safe. We understand that there's considerable posting on social media and people have real questions and real concerns, but we'd ask the public to be very mindful of what they share online. By sharing footage, this could risk causing further trauma to the injured man's loved ones and may impact upon the ongoing investigation. So I would urge caution and ask that people do not share the videos and images that they may have seen circulating. We're also aware of calls this evening for protest activity across Northern Ireland and continue to monitor that situation accordingly. I understand that last night's attempted murder will leave people feeling a range of emotions from fear to anger. Our officers have a role to facilitate and accommodate peaceful protest. Everyone in Northern Ireland will, however, sadly remember the disorder which took place over the last 2 years. No one needs to see a repeat of this. This only causes damage to local communities, and unfortunately young people often get caught up in that disorder. So I appeal for calm and the safety of all of our communities in response to this. All of our focus must be on the criminal justice investigation. We have one individual arrested going through that process, and anything else should not distract us from that important work. Finally, but really importantly, I recognise at a difficult time like this, the public will be looking to us and to me for answers, information and reassurance. I and my teams are committed that as best we can during this fast time investigation to provide clear, factual and accurate information to all our communities across Northern Ireland. And we'll continue to provide updates across the course of today and tomorrow. I'm very happy to take some questions at this point.
There's been a lot of speculation online, and in terms of clarity, is there any update on the migrant status of the Sudanese man, or any update on when people might get that information?
Thank you. I'm aware of speculation in relation to the suspect's immigration status. This morning I've been talking to colleagues from the Home Office, whose role it is to manage the immigration status of individuals. I can confirm my understanding is that the individual was given leave to stay, or remain, in Northern Ireland. But I know that colleagues in the Home Office will be confirming the exact details of the status over the coming days. So you'll hear more from, over the coming hours, you'll hear more from them this afternoon, I hope.
BBC. It does appear from the video that is circulating that your officers arrived on the scene fairly quickly. What have you been able to establish about the timeline of events? Was this a sudden, random attack, or were there indications that there was any sort of interactions that led up to it, or there was any reports of disturbances before it?
Well, we're at the very early stages of our investigation, so I don't want to speculate, nor do I want other people speculating as to what led up to this horrific incident. But I can confirm that our officers were on the scene quickly after the members of the public intervened to provide first aid and make that arrest. Over the course of the coming hours, as we move through our investigation, we will start to learn more as to what motivated the offence, but at this stage I don't want to give any further information around that.
In terms of the suspect, did he live in the area where the attack took place?
Yes, our understanding is the suspect lived close by to where the incident took place.
RTE?
Do we know if the suspect was known to the victim?
Well, at this stage, again, very early in the investigation, that clearly will be an important line of inquiry for us as we move forward over the next number of hours as we take it through. But at this stage, again, I don't want to speculate. Please let's let the criminal justice process take its course, and when I have information I can verify and I can share with the public, of course I will.
GBNI. The Secretary of State has said that the police service will give us the answers to these questions. And back to the visa situation, how did he get into Northern Ireland in the first place? Was it illegally or legally, and was it through the Republic of Ireland? And is that why there's a mix-up on his nationality? Is his visa something different from his birthplace?
Well, in terms of the nationality, you'll be aware this morning our belief was that the male was Somalian. That was from the very quick first look at our investigation. We now know him to be, or believe him to be, Sudanese. In terms of the broader question around the immigration status, I don't want to appear that I'm trying to deflect on this. I think it's absolutely right that the Home Office will give you further clarity on it. But again, working with them this morning, my understanding is that the individual came into Northern Ireland from Dublin, moving up, and then was granted leave to remain. But as I say, colleagues from the Home Office will be confirming that in more detail in due course.
Belfast Telegraph.
There's been a lot of information on social media about businesses potentially having to close early in case of potential protests or riots. Is that being advised?
Well, we're aware of a number of social media posts calling for protest activity this evening. I want to stress that I absolutely understand that people will be feeling a range of emotions from fear through to anger and want to have their voice heard. We here in Northern Ireland are very experienced at being able to facilitate protest in a peaceful way and let people have their voice heard. And if there are protests, we very much hope that they will be in that way. And indeed, we would expect and hope that those people who may want to protest will allow people to go about their own lives and be able to go to the shops and do what they want to do, whilst if there are protests there ongoing, that would be very much our expectation of what we'd like to see. So we're absolutely not advising premises to close. People clearly will make their own mind up. They'll be seeing what's written online, and that might cause them to do their own thing in relation to that. From our perspective, we hope and we absolutely expect we want to see protests that allow people to go about their normal lives.
Cool.
What's your message to people who may wish to use this attack as an opportunity to create violence on the streets? And are you confident you have the special resources to cope with that if that indeed is the case?
I want to draw everyone's attention to the heroic actions of those people who intervened, undoubtedly saving the life of the person who has been injured in this brutal assault. That is the values of this country. That is the incredible community spirit that we value and pride here in Northern Ireland. That is the spirit with which we should all seek to move forward. Of course, I have some concerns around having seen violence in our streets over the past 2 years. I reiterate that people have a right to have their voice heard, and they have a right to do that peacefully. If that's done in a violent way, all that does, and I saw it firsthand last year, damages communities and drags young people into it. So I would plead for calm heads in relation to that. In terms of the support that we have here, please rest assured that in terms of the investigation, we are putting absolutely everything that we need towards that. And right now, our officers across Northern Ireland are patrolling in a reassuring way to reassure our communities. And again, this evening, we'll be there in sufficient numbers to be able to do that. We've had offers of support from across the UK in policing and from government to make sure that the PSNI are getting what we need to be able to deal with what is in front of us today.
Reuters.
Can the PSNI confirm that the victim is in a serious condition and not in a critical life-threatening condition? And also, can you talk a little bit about anything that you know about motivation? You know, is the police working with any other organisations or statutory bodies such as Health Plus with regard to this investigation?
Yes, thank you. The investigation is at early stages. As I've said already, we're ruling out a terrorist motivation at this stage. However, our minds remain open to the various possibilities as to what the motivation is behind this. We will, of course, as we move ahead, be working with all of those who might be able to provide us further information and context as why what happened last night. You had asked, I think, as well in terms of, just remind me of the
victim, like he's definitely
Thank
in
you.
a serious condition rather than a critical sort of life-threatening condition, and also if you're working with any other like Health Trust or any other statutory bodies with regard to the investigation, or is it purely a policing operation at the minute?
Thank you. In terms of the victim status, so I'm aware there has been speculation on social media in relation to the status of the victim. I will stress again that the victim is seriously injured and in hospital. Our specialist officers, family liaison officers, are with the family as we speak in relation to that. So please, again, I would ask people not to speculate around the victim's health and status. It's not helpful. I think it has the potential to lead to people feeling even more angry and upset around this incident, and please just wait for updates that we will give you clarity when we have it in terms of the current situation.
Tree Radio.
I know you've touched on this, but for foreign nationals here in Northern Ireland watching the news this afternoon, this evening, what are the police going to be doing, or what would your words to them, if you were speaking to them directly now, to reassure them? You've mentioned this is 2 years we've had this type of violence on our streets. There will be people here this afternoon, this evening, feeling not again, feeling very unsafe.
Well, I want to speak really to all of our communities, because I recognise that everyone who has seen what happened last night will be filled with revulsion, fear, horror and upset. And I know, having spoken to members of minority communities, they absolutely share that horror, that revulsion and that upset. Across our communities, people will feel fear. That's why we will be increasing our visible presence across today and across the days ahead to help to reassure people that we are there to keep them safe. We are actively engaging with community groups across Northern Ireland who we know will be affected by this, to help give them that reassurance message, to listen to them and to respond to that. So my message is, please, if you're feeling concerned or worried, please let us know, contact us, be proactive around that. We're here for you, we're here for all our communities.
And last question, the journal.
Yeah, thank you. Just on the AI poster, you've already touched upon it, but there's a message of premises, shops, businesses that goes at 5:30 p.m. Is that something you take seriously, such an threat that's implied in that message?
I want to make a very clear message to say that we absolutely understand that people will want to have their voice heard in relation to the shocking attack of last night, and that can be done in a very peaceful and dignified way, and we here in Policing in Northern Ireland are very used to facilitating and supporting people in doing that. We would appeal for calm to make sure that happens in that way and people can go about their normal business. I do not want to make those shop owners or other businesses feel that they are under threat or that they should be worried, nervous or concerned. Clearly people will make their own judgments around it, and I absolutely understand that, but we are here to facilitate protest in a way that is peaceful. I'll reiterate, nobody in Northern Ireland wants to see a repeat of the disorder that we have seen in recent years. Nobody thinks that that improves the situation or helps to have people's voices heard. It damages communities, damages local businesses, it brings young people into the criminal justice system when they shouldn't be. That's all of our responsibilities to make sure that doesn't happen, and I appeal to everyone with influence to do everything we can to ensure that those protests, if they happen, are peaceful.
Okay, thank you everybody.
Okay, thank you all very much.
Thank you.